Hello, I am Sylvia and I'm going to record primary and secondary piggyback today. So, as a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of the skills testing recording. Okay, so what I will do first is I will look at the MAR. I will go ahead and pull up the orders for my patient. I will make sure that I have the right patient, that I have the right reason for the medication, that I have the right route for the medication, that I have the right time and date. And of course, I want to give my patient the right to refuse. And then, yeah, I will document at the end. First, I want to go ahead and grab my saline, which my patient will be receiving saline because she is dehydrated. So when I pull it from the Omnicell, I want to make sure that I have the right medication, that it is not expired, that it looks clear, and that my bag is not compromised in any way. So now that I know that it is ready, I know that I will also need to hang some antibiotics. I will do the same thing. I will make sure that I pull it from the Omnicell after I have checked the patient's MR. I also want to make sure that I check the patient's MR for allergies. And I want to make sure that it's not contraindicated with any other medications that they are taking, or that it is not, that it is compatible with the IV fluids that I will be hanging. I want to check my antibiotics that my patient will be receiving. I want to check the bag, that it's the right consistency of the medication, that the bag is not compromised, that it's not expired, and that, first of all, it is the right medication for my patient. I want to have my tubing for my primary. I want to have my tubing for my secondary, and I want to have an IV flush, a saline flush, excuse me, because I want to confirm that before inserting the tubing into my patient, I want to flush out the IV that they currently have on already, that I placed earlier today, because I want to make sure that the IV is still good. Okay, so I will come into the room after I have done all my checks, and I'm going to come in, knock on the door, perform hand hygiene. Hello, Ms. Smith, I am back. Sylvia again. I placed your IV earlier. Now I'm going to hang your fluids and your antibiotic. Looks like you have an infection going on, right? And you're also a little dehydrated, like the patient, like the doctor explained to you. Yeah, so what we're going to do is we are going to give you IV fluids, and I'm going to give you antibiotics. They are all going to go through your IV, so there is no additional poking that I will be doing, and you should not feel any pain, but if you do, you let me know. Okay, so can you please confirm your name and date of birth with me? Okay, Lana Smith, 10/20/85, perfect. I checked with the badge on her hand. What I want to do now is I want to come to the MAR in the patient's room, and I'm going to do my second check by evaluating my fluids while I have them in my hand, that I still have the right ones that I pulled from the from the MedCart. I have my solution for hydration. I have my antibiotics. It's the one I pulled. They're both within the dates, so they are not expired. Both bags are good, so they are not compromised. My third check will be with the MAR at the patient's room. I will check the orders again. I will check the orders on the computer against what I have in my hand. I will go ahead and grab the scanner. Okay, Miss Smith, I'm going to scan your badge, if that's okay. Scan the badge, pulls up Lana Smith. And now what I want to do is I want to scan my bags. So scan my hydration solution, which is sodium chloride. I want to scan my antibiotic. They are set to go. I will set that aside. And what I want to do now is my usual, I will raise the bed up to a position where I'm gonna be working, lower the rail, and make sure that the bed is locked, make sure that my patient is comfortable. And I want to evaluate the IV sign. So what I wanna do is I wanna make sure, and talk to my patient through this process, but what I wanna do is I wanna make sure that there is no redness, that there is no swelling, that the IV is fully intact and there is no bleeding. The IV looks good. What I will do now is I'm going to hang my primary IV bag. So I will open up, what I will do now is I'm gonna perform hand hygiene. I'm gonna put on my gloves because I wanna have my gloves on. And I wanna ask my patient if it's okay if I give the hydration solution and the antibiotics. My patient has agreed. I have checked that I have the right patient. I have checked that I have the right drug. I have checked that I have the right reason for giving this patient the fluids and antibiotics. I have checked that I have the right time for this antibiotic and hydration, and I also have given the opportunity for my patient to refuse. I will document the whole process at the end. What I want to do now is I want to open up my IV tubing, maintaining sterilization. I do not want to let this touch the floor or anything else. I want to make sure that I inspect my IV tubing and that there is no kinks or nothing is broken, nothing is ripped. It's a little tangled, but I will go ahead and untangle it. Perfect. And I want to make sure that I maintain sterility and not touch or open anything until I am fully ready. What I want to do is I want to make sure that my tubing is clamped. I want to hang my first bag. And I want to be talking to the patient while I do this process. Actually, what I will do, just so that it doesn't drip, I'm going to open up my bag. I do not want to touch this because it is sterile. I do not want to touch this also because it is sterile. So I want to go ahead and make sure I wiggle this in, and I confirmed that it was clamped, so nothing will be falling down. Perfect. I have hung my first bag. I want to open the machine. First, I have to make sure it's on. So I am turning on the machine. And while the machine is going, I can start by filling up my chamber. Okay. I want to open up the machine. Yes. Okay. So what I want to do now is I want to work from right to left. I want to make sure there's no kinks in my tubing. I want to close that up. And I want to make sure that I am maintaining sterility, and I do not want to plug this into my patient until I know that I have primed it and it is ready to go. I'm gonna grab my trash because it's gonna prime. I want to make sure that I have a trash can or something by the side because it's going to ask me if I want to prime it, and I'm going to say yes. It's asking me to make sure it's not connected to my patient. No, it's not. I'm going to hit OK. And now it is asking me for an occlusion. Why? Because my clamp is on, so I have already unclamped it. Confirm, say OK. And now it's going to prime it. Okay, it's priming. So the reason why we want to prime is we want to make sure that all the air bubbles are out. We do not want to put any bubbles into our patient and create a possible embolism that can be very harmful for the patient. And while this is priming, this is a perfect opportunity to ask my patient if they are allergic to any medications. My patient said no. I had already previously confirmed with Amar, but I also want to ask my patient, just to be on the safe side, I also want to ask my patient if they are allergic to any latex. They said no, so that is perfect. Just conversate with my patient while this is priming. Okay, priming is done. Now I want to program my pump. And I'm gonna ask to program my pump now. So it's asking me for a primary. Yes, I want to prime my primary, and I'm going to set the rate at 75. 75. Okay, say okay. And now it's gonna ask me for the volume to be infused. My bag is 1,000 mLs, but I want to do 900 mLs. And reason for that is because I do not want to, I wanna make sure that the alarm is going to go off prior to the bag being empty. I never wanna leave the line without anything. Okay, so I'm gonna confirm it's going at a rate of 75 mLs. My volume to be infused is 900. This is perfect. What I'm going to do now is, since I have already assessed my patient, I want to make sure that I'm going to flush out my patient, because I inserted this IV early in the morning. However, it definitely could go bad between the time I've inserted the IV and now. So what I want to do is I want to make sure that I come to the IV site. I'm going to clean the hub for 30 seconds. After I have cleaned the hub for 30 seconds, I'm going to go ahead and prime. Okay, I've primed my saline that I'm going to flush with. And now what I want to do is I'm gonna insert it. Make sure it's tight. So what I want to do is I want to draw back, make sure I get blood return. Okay, and now I did get blood return, so what I want to see, I want to make sure I unclamp it also. Okay, I want to try to get blood return. Yep, there's the blood return. Now that I see that, I know it's a good IV. It's still working. I'm gonna flush. Perfect. And now that I am ready, I want to insert my fluids. So this is still fully intact. I never removed the tab, so it is fully clean. Oh, I haven't started it, that's why it's asking me to, it's beeping on me. So what I want to do is maintain sterility. I do not want to touch that. However, I do want to clean the hub again. Okay, so clean the hub, 30 seconds. And now I want to insert my fluids. Okay, that one is going. I want to say primary to be infused. Perfect. And now I have confirmed again the rate and the volume that is going to be infused. Now I want to say start. Before I start, I want to make sure that my clamp is open. So it's asking me if I want to start, and I said yes. What I want to see to make sure that it is being infused into my patient is I want to make sure that there is a drip coming down, and I also want to check that the machine is working properly. Okay, so I check everything before I leave the room. I want to make sure I check my IV tubing starting from the patient, back up to the IV. Is going well. Perfect. Now, since I do know I have a secondary that I want to hang, I'm going to hang my antibiotics. I have already checked with the MAR. I have already done my patient's rights. I have already checked it here in the room. So now that I have everything going, I'm going to hang my my second. So I'm going to explain to the patient. Okay, so again, you're not going to feel any pain. This is your antibiotic, just as I explained to you a little bit ago. What you got infusing in you is just the hydration solution, just so you don't get dehydrated. So it's just fluids. This is your antibiotic. Again, you will not feel any pain. I want to stop my machine before I hang my second bag. So I will stop my machine. Now what I'm going to do is I'm going to open up my supplies for my piggyback. Again, I want to make sure I maintain sterility. I want to make sure that my tubing looks appropriate, that there's no kinks, that it is not ripped. I want to make sure that it is clamped. Okay. And this one's still brand new. It has a cap, still fully sterile. So now what I want to do is I want to make my antibiotics stay up in the top. Reason being is because I want this to be infused first, and the hydration solution, the sodium chloride, will be infused right after the antibiotics finish. As I mentioned earlier, we never want to have a line be dry. So what I will do is, oh, there's one already here for me, is I want to hang my bag lower than what I want infused first. Okay. I want to maintain sterility. I want to open it up, and I want to make sure I wiggle it in without touching it. Sometimes you have to use a little bit of force. Now, what I want to do is I want to prime this bag, but what I will do first is I'm going to connect it to my first Y that is closer to the bag that was already going. Okay, so I want to clean the hub, 30 seconds. My tubing for my secondary is brand new, so it's got the cap. I will remove the cap, still fully sterile. I have cleaned the T. It's going in. Make sure it's fully in there, tight. Now what I want to do is I want to prime my secondary, and to be able to do that, I want to open up the clamp, and I want to bring my bag lower so that I can get some fluids to go back up and remove all the bubbles that are in my line. Okay, so I will do that now. And as you can see, All the bubbles from my line are going back in. There's no more bubbles, so I will stop. And I want to make sure that that I have fluid in my chamber, but I can also see the drip. So like I mentioned, I want this to go up higher. And my machine is just beeping because it's asking me to hurry up. What I want to do now is I'm going to silence the alarm for now. And what I'm going to do is I'm going to ask to set rates for my secondary. Okay, so here we go. I gotta kind of maneuver through and find my secondary, say okay. Do I want to set a new secondary? Yes, okay. Use dose rate calculation, I want to say no. I'm gonna manually put everything in. And what I want to do is, I know that my volume that has to be inserted, it's going to be set at 200 mLs, and that's gonna be for 30 minutes. My bag is 100 mLs, but we wanna infuse it faster, so we're gonna set it at a 200 ml rate, and then it's gonna go for 30 minutes. So let me set that up. Perfect, I have set everything. So the rate is gonna go at 400 mLs per hour. It's gonna be infusing, it says it's infusing 200 mLs, but in reality, it's only infusing 100. And I'm going to do it for 30 minutes. What I wanna do is I wanna start the process. So it's asking me, do I want to infuse now? I'm going to say yes. So it's asking me unclamp. Perfect. Let me go ahead and unclamp it and hit start. Okay. What I want to see is I want to make sure that it is dripping. I want to make sure that my primary is not dripping, that only my antibiotics are dripping, because that's what's going in first. What I want to do now is I want to assess the site. I want to make sure that the fluids are going in, that there is no puffiness, no redness, no swelling in the area, that the patient is tolerating it okay. I want to ask my patient if there's any pain. I want to ask my patient if they are tolerating it okay. My patient said yes. Now what I want to do is I want to initial time and date both of my bags, so that anybody that comes in and checks will know what time these bags were being put in. And now what I want to do is I want to document in the MAR exactly what I did. I want to make sure I document that I put in a primary, the rate, the volume that was infused, and at what time it was done. I want to make sure I document my secondary, again, the medication I'm putting in, the rate is going in, the time I went in, and I want to also document that I did assess the IV site, that my patient is tolerating it okay, and I want to document that I did ask for allergies for my patient. What I want to do now is I want to make sure that I bring the bed all the way down, that the rails are up, that the bed is fully locked, that my patient is fully comfortable. I want to clean up everything that I was working with, get rid of all the trash, throw everything where it needs to be thrown in. I want to perform hand hygiene, and again, I want to evaluate my IV before I leave. I want to make sure that my pump is plugged in or has enough battery, yeah, I am all set.